I mean, Maddie was a healthy, happy, has always been a healthy, happy girl. Yeah. And around the time when she should have been crawling and pulling herself up and walking, she wasn't doing some of those things. So we started to talk a little bit with our family doctor.
Starting around age 2, she still wasn't walking on her own, so she needed to be assisted with the walking. In our house, she needed to be helped with the stairs, so she wasn't able to climb up and down the stairs. And just balance, she would lose her balance quite easily and fall.
And at around age 3, the diagnosis of cerebral palsy was made.
So cerebral palsy is a condition that, that can happen before, during or shortly after birth. We see a lot of children and adults with difficulty walking, mostly because they have difficulty controlling their muscles, with controlling their movement and posture.
We wanted her always to be able to join in with friends to do whatever was going on. And at a really young age with cerebral palsy, you don't necessarily know if it's going to be, what it might limit physically.
We sometimes see difficulties with keeping balance, or they are more fatigued, and that will impact their mobility, and that of course has an impact on how they get around at home, at school and in the community. Things like participation in sports and other fun activities. So it's very important to parents and also for us in terms of the development of children to help them walk as comfortable as possible, and also to make sure that over time when they grow that they keep their mobility. Okay. So as you can see, we have many cameras here in the motion lab. So basically motion is captured from the front, from the side, from different ways. If I see a child walking in clinic, I can only see it from one angle. So that's one big advantage of the motion lab. The second thing is that because we digitalize all that information, we have standstills. We can look at every moment a child makes and can look at different joints at the same time.
We had a motion lab study done, which helped really objectively to tell us that this surgery had really good potential, even with all the risks, had really good potential to allow Madeleine to do more of what she wanted to be able to do, and it would be a permanent change.
For Madeleine was a good example of where we could use the information, not only to document, but also to share that information with the family to help them to make a decision.
We've noticed really big improvements. And it's not that before Madeleine wasn't trying things or doing things, because she did it all. She did it a little differently.
It was nice to see her kind of running with her friends and kind of running alongside of them. And she participated in the cross-country race, and she's always needed someone to run with her. So for the first time this spring, she ran alone. So it's just a lot of satisfaction that she can do things on her own now, and she doesn't always need our support or somebody else's support.
Well, I think in her situation, because we could demonstrate that overactivity of the muscles was key to her problem, through the surgery we could manage that, we could take that away. Basically the problem is gone now, and so that has changed the whole trajectory of her, I think, development. We want to give them a full life and want to provide them everything we can do to make sure that that life is not only full but also in a healthy and they want to be happy.
It's no doubt in our minds and in her minds that she's being cared for. I mean, the clinical expertise is here for sure, but even more important than that, as her parents, I think knowing that the people here care for her and want her to have a great outcome and just a great life.